dislocations of the lunate bone, and lunotriquetral ligament injury. Anatomy. There are 8 carpal bones. Mainly, this involves the scaphoid, lunate, triquetral, capitate, and hamate. These are the bones directly surrounding the lunate. The lunotriquetral, radioscaphoid capitate, and scapholunate interosseous ligaments are also involved in this injury, as well as the radius and the ulna. Pathology of this injury for the lunate is a volar displacement and rotation of the lunate bone by ligamentous injury or displacement of rotation. Lunate dislocations are rare. In a lunate dislocation, all other carpal bones remain in their correct anatomical locations. Pathology of a paralunate dislocation is the radiolunate joint is still intact, but many other ligaments are injured. And a paralunate dislocation is the less severe form of a lunate dislocation. Accompanying injuries. If a patient has a paralunate injury, they may also have a lunotriquetral ligament injury, and this is because this ligament has the same mechanism of injury as the paralunate dislocations. However, some injuries to the lunotriquetral ligament go unrecognized because it has no signs and symptoms. However, there are 4 classifications of lunotriquetral ligament tears. Like I said, there are 4 types of ligament tears. Type 1 being predynamic, which is just a partial tear of the ligament. Classification 2 is a dynamic, which is a complete rupture of the ligament. Classification 3 is a static. It's a complete tear of the ligament along with other extrinsic ligaments. Type 4 is osteoarthrotic, which is a complete tear of the ligament along with other intrinsic ligaments, resulting in signs of mid-carpal articular degeneration. Mechanism of injury for a lunate dislocation is falling on outstretched hands or foos, sports such as inline skating or snowboarding, or car accidents. Paralunate dislocations have all of the same mechanism of injuries plus 1. Another mechanism of injury for a paralunate is the hyperextension of the wrist with ulnar deviation. And like I said before, the lunotriquetral ligament injury has all of the same mechanism of injuries as the paralunate dislocations. Signs and symptoms for both lunate and paralunate are the same. It's pain in the wrist and palm of the hand, swelling, or numbness and tingling of the hand and fingers. There are 2 different special tests that I'm going to talk about, one for lunate dislocations and one for lunotriquetral ligamentous injuries. Starting with the Murphy's sign, it is a test where the patient's hand is in a fist on the table. You're looking at the patient's 3rd knuckle, because that knuckle on most people should be more prominent than the others. A positive Murphy's sign is if the 3rd knuckle is even with the 2nd and 4th knuckles. That is the test for the lunate dislocation. The Reagan's test is the test for lunotriquetral ligamentous injury. It is where the examiner uses both hands to stabilize the lunate on either side. Moving one hand at a time, you move in a ventral to dorsal pattern, and if the patient has pain when you're moving their hand, it's a positive test. Predisposing factors for lunate dislocations are pretty similar to all other injuries. It's osteoporosis, if you're a smoker, if you have an improper diet, or if you're participating in sports that lead to falling a lot. When a patient has a lunate dislocation, they must be referred to a doctor immediately. When sending a patient to the doctor, you must stabilize their hand, and most people do this by using a SAM splint. These patients have to go see a doctor as soon as possible because in all of these cases, surgery is necessary to relocate the lunate in a proper fashion, as well as repair the ligaments that have been injured. Management and treatment for this injury, like I said, is stabilize the hand and wrist because you're going to send them immediately to the doctor. At the doctor, they will be getting x-rays or a CT scan. In x-rays, the dislocations can be easily missed, but the CT is just used to identify any ligamentous injury. Following those tests, they will be sent to surgery. As you can see in this x-ray, there's an arrow pointing to the dislocated lunate. But if that arrow wasn't there, some people wouldn't necessarily realize that that was an issue. For prevention of these dislocations, it sounds kind of funny, but just avoiding falling whenever you can. I know sometimes you can't help it, but if you can, just avoiding falling on your hands. And having proper nutrition is so important to avoid any bone weakness. And if you've had a previous dislocation or wrist injury at all, having proper wrist bracing or taping during sport activity is really, really important. For this injury, there is no mulligan technique due to how serious and how many components of an injury there can be. For the differential diagnosis, I lumped it all into one because there can be a lunate dislocation or a paralunate dislocation, a mid-carpal dislocation. It can sometimes be diagnosed as carpal tunnel syndrome because of the numbness and tingling, or some patients might just think it's arthritis, or there's always just the possibility of someone thinking that it's just strictly ligamentous injury. For my PCOT analysis, I looked at a case studying a 25-year-old male. This male had a wrist injury that was diagnosed as carpal tunnel syndrome. Later, they found out that it was a lunate dislocation, and they had to actually go in and do that surgery. This patient did have a successful surgery, so he got the use of his hand back, and he could successfully go back to his activities of daily living. However, to get to him to that point, it took almost 2.5 years.